Good afternoon. We are now going to move on to our next lecture for your exam number 1. This is going to be for week 4, and we're going to start with evidence-based practice. So evidence-based practice, what is the definition? So evidence-based practice is a problem-solving approach to clinical practice that integrates the conscientious use of best practice in combination with a clinician's expertise and patient preferences and values in making decisions about patient care. It results the highest quality of healthcare and patient outcomes. So evidence-based practice is something that you guys are going to learn right now, and you will continue to hear this throughout your entire career in the health field, because that is where our nursing treatments and medical treatments and things come from. They come from evidence-based practice. So there are many sources of knowledge. We're going to talk about traditional, authoritative, and scientific. So traditional knowledge is knowledge that has been passed down from generation to generation. Changing bedclothes is an example of how traditional knowledge has affected the nursing practice. For instance, it's customary in the acute care setting in the hospitals to change a patient's bedclothes daily. Whether they're soiled or not, we always go in and we change their sheets daily. There are no research data to support this, yet virtually millions of hospital beds are changed daily because this practice is accepted and it's deemed a necessary component of quality patient care. We have authoritative, which comes from an expert. It usually is accepted as truth-based on a person's perceived expertise. An example of authoritative would be when a senior staff nurse teaches a new graduate nurse a more efficient method of doing a technical procedure, such as inserting an IV catheter or inserting a Foley. The senior nurse has gained knowledge through her expertise as a nurse, and the new grad accepts it as the truth based on the perceived authority of the experienced nurse. So this is a lot that you will probably see in the healthcare field in nursing. And then we have a scientific source of knowledge, and that's obtained through a scientific method, meaning research. All right. So, types of nursing knowledge. There is science, which is the knowledge in and of nursing. There is philosophy, which is the study of wisdom, fundamental knowledge and processes used to construct life. And then there is process, which is conceptual frameworks and theories. So influences on nursing knowledge. So we have historical influences, okay, that have made a huge impact on what we know about nursing. And examples of historical influences would be Florence Nightingale. We just learned all about that, right, during our first week. And then some societal changes that took place from what happened earlier back many years ago from the times of Florence Nightingale. And then we have societal influences, which would be our school of nursing and that type of information. All right, so framework of nursing theory. So theory is a group of concepts that describe a pattern of reality. You can test them, change them, and use them to help guide your research on a particular topic. Then you have concepts, which are abstract impressions organized into symbols of reality. A group of concepts that follows an understandable pattern and makes up a conceptual framework or model. And we're going to talk more about these. All right, so we have interdisciplinary base for nursing theories. So we have what we call a general systems theory. So the general systems theory is a theory for universal application. It breaks whole things into parts to see how they work together in the system. General systems theory has been used in a wide range of disciplines since it emerged in the early 1920s. Its primary theorist is Ludwig von Bertalanffy, and I'm sure I said that wrong. He developed the theory for universal application. This theory describes how to break whole things into parts and then how to learn how the parts work together to make up that system. This theory emphasizes relationships between the whole and the parts, and it describes how parts function and behave. And we have the adaptation theory, which is adjusting of living matter to other living things and environment. So this theory defines adaptation as the adjustment of the living matter to other living matters and to their environmental conditions. So what happens in their environment that changes them in some way, shape, or form. So the adaptation theory is a continuously occurring process, meaning it just keeps going, and it affects change and involves interaction and response from things in your environment. And then we have the developmental theory, which is orderly and predictable growth and development from conception to death. So the developmental theory outlines the process of growth and development of humans as an orderly and predictable process, beginning with conception and then ending with death. Although the pattern has definite stages, the progress and behaviors of a person within each stage are unique. All right, so what are the benefits of nursing theories? So theory-based nursing directs a nurse towards a common goal, with the ultimate outcome being improved patient care. That's ultimately what we want. We want evidence-based care, we want safe care, and we want all of the care that we provide to improve patient-centered care. Nursing theory provides rational and knowledgeable reasons for why we implement nursing interventions, and it's based on descriptions of what nursing is and what nurses do. Additionally, nursing theory gives the nurse the knowledge base necessary for acting and responding appropriately in nursing care situations. It provides a base for discussion and ideally helps current nursing issues. Theory gives nurses who know and practice theory better problem-solving skills so that the nursing interventions are better organized, considered, and purposeful. Nursing theory also prepares nurses to question assumptions and values in nursing. This, in turn, further defines nursing and increases the knowledge base that we have. It serves research, it serves education, and it serves our nursing practice. So it does a lot. All right, so what are our goals of theoretical frameworks? Well, we have holistic patient care, right? Holistic patient care is treating the whole entire patient, right? Their mental well-being, their physical well-being, their emotional well-being, their spiritual well-being. It's encompassing every part that's important to the patient. We treat that, not just their physical issues. Then we have individualized care to meet the needs of the patient. So each care, the care that you provide to Mrs. Jones may not be the same care that you provide to Mrs. Brown, because their needs are going to be completely different. We have promotion of health. So education, right? Patients might come into the hospital because they have an issue, but we're going to try and promote their health. We're going to teach them things about preventing certain issues from happening. So a lot of education is going to go on for promoting the health, and then we want to prevent certain issues from occurring so that they don't have to come back to the hospital again. All right. So the most important concept of nursing theory is the person. And the person is the patient, okay? That is always going to be the most important concept. So we're going to talk about what are some goals of research. So we want to develop explanations in theory. So the ultimate goal of expanding a nursing body of knowledge is to learn improved ways so that we can promote and maintain health within our patients. So what worked 25 years ago might not necessarily work right now. And a good example of that would be, it used to be, I've been a nurse for 6 years, and it used to be when I first started that evidence-based practice or best practice was that when we had a patient with an IV, that their IV could only stay in for 3 days while they were in the hospital. And that each time we went into the room before we gave them anything, we had to check it for blood return. Well, since I've been a nurse in these last 6 years, evidence-based practice has changed. So now in our hospital, it's our policy that the patient's IV is good for the duration of their stay at the hospital, not just those 3 days anymore. If it's clean, dry, and intact, it doesn't have any redness or burning or pain, any blood around the site, anything like that. And not only do we not have to change the IV, but we do not have to check for blood return anymore. As long as the IV flushes and there is no redness or swelling or coolness in the arm, the IV is fine. So that's what we mean about expanding a nursing a body of knowledge to learn improved ways so that we can continue to promote safety and health for our patients. So as healthcare and illness patterns change, nursing interventions must also change. So the more we learn about things, the more we have to change things. So ongoing practice-based research reflects the nursing profession's commitment to meet the ever-changing demands of healthcare consumers. So this is something you're always going to hear about. Contributing to education and being able to meet the changing demands is something that you're going to have to contribute to as a nurse, because our practice is always changing. And it's an expectation when you become a nurse that you help commit to these evidence-based practices that we determine. Goals of research, so they develop explanations and they find solutions to problems. So those are goals when we're researching something. So nursing research, broadly defined, encompasses research to improve the care of people in the clinical setting, as well as the broader study of people and the nursing profession, including studies of education, policy development, ethics, and nursing history. Research is included as an essential component of nursing by the American Nurses Association, the International Council of Nurses, and by nursing specialty organizations. One of the many ways that we promote nursing development of greater autonomy and strength is nursing research. Nurses, depending on their level of education, conduct or participate in research to improve their efforts to deliver high quality, cost-efficient care. Nurses also increasingly use the findings of research to provide evidence-based nursing practice, okay? So policy development, education, ethics, nursing history, these are all things that you're going to continue to talk about when you get jobs, when you're in the clinical setting, okay? Because education is a huge part of nursing. Developing policies. Maybe you'll sit on a team in your hospital, like where I work. If you have a job on any of the units as a nurse, you have to commit to being part of a certain committee, say for instance, CAUTI. So CAUTI is a committee that looks at ways to decrease the risks of a catheter-associated UTI in patients. So maybe you and a couple other people that are in that committee will develop policies in your hospital that represent evidence-based practice, that keep your rates of developing a CAUTI down to a small level. So that's what I mean by policy development and ethics and things like that. So that's something you're always going to be responsible for doing as a nurse. So we want more goals of research. We want to build the scientific foundation for our clinical practice, for you, for future nurses. We want to prevent disease and disability. We want our patients to be healthy. We don't want them to have these diseases. We're treating them now in the hospitals for these diseases, but ultimately we want to prevent these diseases by educating our patients. We want to manage and eliminate symptoms that are caused by illnesses. We want to enhance end of life and palliative care. So these patients who are terminally ill or they don't have a long time to live, we want their quality of life to be the best. We want them to be able to, what they quote unquote, die with dignity. They want to do things on their terms. We want them to be comfortable and really enjoy their last days here. And then we want to learn improved ways to promote and maintain health. So there are methods that we use for nursing research. So we have quantitative and qualitative. So quantitative involves concepts of basic and applied research. Qualitative is conducted to gain insight by discovering meanings, and then it's based on the belief that reality is based on perceptions that differ for each person and change over time. So, evaluating the ethics of clinical research studies. So we have value. Value is enhancements of health or knowledge that must be derived from research. Scientific validity is the research must be methodically rigorous, means you have to, which basically means you have to conduct research within a well-defined design. You have to use appropriate methods, and you have to work with logical, methodological rigor, which may contribute to the substantiation of the claim that the researcher makes. So the methodical, I cannot say that word, methodological rigor, I pronounced it wrong 3 times, I apologize, of the chapters will be praiseworthy. They want your fair subject selections, your scientific objectives, not vulnerability or privilege, and the potential for and disruption of risks and benefits should determine communities selected as study sites and the inclusion criteria for individual subjects. So this is something, I'm just trying to get you guys used to hearing these words. This is not something that you're really going to do, and it probably sounds like a foreign language to you, but as you continue to grow in your nursing practice and in your education, these things are really going to start making sense to you. Then we have favorable risk-benefit ratio. So within the context of standard clinical practice and the research protocol, risks must be minimized and potential benefits must be enhanced. And the potential benefits to people and knowledge gained for society must outweigh the risks, okay? So what we're looking to implement has to outweigh the risks. It has to be beneficial for your patients, and it has to be, the benefits have to outweigh the risks. Then you have independent review, which is unaffiliated people must review the research and approve, amend, or terminate it. So we want people that are not affiliated or don't share with our information or our opinions to look at this and give an unbiased review. You want them to be able to look at it as an outside source and make sure that they can approve it, or if they have to make any changes or they don't think it's good, and then they can terminate it. We have to have informed consent. So the people that are in our studies, they should be informed about the research and they should provide their voluntary consent. And then we have respect for enrolled subjects. So subjects should have their privacy protected, the opportunity to withdraw if they don't feel like they want to be part of the program anymore or the study. And then we have to have their well-being monitored. So what are the types of quantitative research? So we have descriptive, correlational, quasi-experimental, and then experimental. So descriptive is to explore and describe events in real-life situations, to describe concepts and identifying relationships between and among events, often used to generate a new knowledge about topics with little or no prior research beforehand. Correlational is to examine the type and degree of relationships between 2 or more variables. Then your quasi-experimental is to examine cause and effect relationships between selected variables, often conducted in clinical settings, to examine the effects of nursing interventions and patient outcomes. And then you have experimental, which is used to examine cause and effect relationships between variables under highly controlled conditions, often conducted in a laboratory setting. So we have our qualitative research methods, which are phenomenology, grounded theory, ethnography, and historical. Phenomenology is the purpose of phenomenology, which is both a philosophy and a research-based method to describe experiences as they are lived by the subjects being studied. It's an analysis of data which provides information about the meaning of the experience within each person's own reality. So the experience of health, or perhaps maybe having a heart attack, it's their own person's their experience with any type of issue that you're researching. Then you have grounded theory, which is the basis of grounded theory methodology is basically discovering how people describe their own reality and how their beliefs are related to their actions in a social scene. The findings are grounded in the data from subjects and are used to formulate concepts and to generate a theory of the experience, which is usually supported by examples from the data, like maybe, for example, how parents cope with a seriously ill child, something like that. Then you have ethnography, which was developed by the discipline of anthropology. Ethnographic research is used to examine issues of a culture that are of interest to nursing. And then you have historical, which is historical research examines events of the past to increase an understanding of the nursing profession today. Many historical studies focus on nursing leaders, but there is increasing interest in the historical patterns of nursing practice. All right. So impediments to nursing research. So things that impede nursing research are restricted access to various resources, limited time to participate in research, and then just your lack of educational preparedness for whatever it is you're learning about or you're trying to learn about. So evidence-based practice in nursing, like we said, is a problem-solving approach to making clinical decisions using the best evidence available. It's considered best, okay, best evidence, because it's collected from sources such as published research, national standards already in play, and then guidelines and reviews of targeted literature. Research findings have shown that patients who receive care based on the best research evidence experience better outcomes. Research findings suggest that the healthcare providers who use an evidence-based approach to patient care have higher levels of satisfaction compared to healthcare practitioners who give care based solely on tradition. And I think that that makes sense. If you continue to provide care that's based on traditional methods, then you're not growing and you're not learning anything new that can contribute to better outcomes. If you're using evidence-based practice, you know that these methods have been tried, they've been implemented, they've been reviewed, and these are evidence-based. We've seen it, we know it, there's evidence that these things work. Then it just makes sense that our patients are gonna that they're gonna get a higher level of care. Okay. So nursing care that is based only on statements such as, this is the way it was always been done, or I've been working here for 15 years and I know this is the best way, are not sufficient in today's healthcare environment. And that statement is 100% true. There are things that I've learned in the last 6 years that don't apply anymore. So whenever I walk into a clinical setting and I'm working with other nurses and I go to do something a certain way and a nurse says, well, have you ever done it this way? Well, no, I haven't. And that's a great idea. Thank you for showing me that. Or, maybe my idea is still good, but this way is a better way to do it. And you have to be teachable so that you can take that knowledge, because you recognize that it's not about how smart you are. It's about delivering the best care to your patient, and it's about continuation of learning. So as nurses, you are always going to be continuously learning. And I feel like nursing is the only field where you don't have to know 100% of everything. And it's completely okay to ask questions. I have nurses that I work with that have been nurses for 30 plus years, and they come to me and ask questions, because you're not going to see everything. You're not going to do everything. You're not going to encounter everything that you could possibly ever encounter in nursing. So it's always okay to ask questions. It's okay to be teachable. It's okay to let somebody else teach you things, because ultimately it benefits the patient. And then evidence-based practice is a way for nurses to examine nursing practices, to analyze alternative and contradictory data, and to be able to make sound nursing decisions that are supported by the best available research evidence. Research findings are often delayed in being implemented into clinical setting. It takes an average of 17 years for clinical research to be fully integrated into clinical practice. So that's a long time. Most nurses at the bedside do not have access to the latest in scientific research. They often care for patients based on tradition or standards. I feel like yes and no, that's true. I know our hospital where we work, we have these team members who are always promoting evidence-based practice. We're always looking at things. We have nurse residency programs that we put into place for our new grad nurses. It's about a year-long program, and you have to do an evidence-based research project at the end. I know personally we've had nursing-based research products that have implemented in huge policy changes on the floors of my hospital. But I do actually agree that there are some nurses that probably practice based upon older methods because that is what they feel is comfortable. So implementing evidence-based practice in the clinical practice can result in multiple challenges. There's resistance to using EBP because it may arise in the current healthcare setting as a result of a nursing shortage. The acuity level of patients, a nurse's skill in reading and evaluating published research, and then an organizational culture that does not support change. So that's really important, who you work for. I can say that who I work for, they do have a culture that supports change. They always want to have that most evidence-based practice implemented because we know it's associated with great patient outcomes. We know that great patient outcomes lead to happy, satisfied patients. And then when they get those little letters in the mail asking them to review their stay, their HCAHPS scores are good because patients are happy. And if patients are happy and HCAHPS scores are good, then the hospital gets more money. So it's kind of like it's a huge circle. One thing affects the other. The acuity level of patients and nursing shortage, that definitely is a real issue. I can see that. I've seen it play out on floors when we want to try and implement something new, but we're always short-staffed and it sounds good on paper. Well, we can't always implement it because we're not fully staffed to do it, or our patients are just too sick, and that gets in the way of us implementing things that we would like to implement. Other factors include insufficient time to implement new ideas, insufficient time to read the research, lack of authority to change patient care procedures, and then lack of support from your physicians, your managers, and other staff members. And then an inadequate infrastructure support, such as your libraries and your ethics committees. So there's a lot of different things that play into getting that evidence-based practice into play. Evidence-based practice is a problem-solving approach to making clinical decisions using the best evidence available. It blends both the science and the art of nursing so that the best patient outcomes are achieved. It may consist of specific nursing interventions or may use guidelines that are established for the care of patients with certain illnesses, treatments, or surgical procedures. And then the use of EBP mandates the analysis and systematic review of research findings. All right. So the steps to evidence-based practice. So where do we start? So step 0 is to cultivate a spirit on inquire. So what do we notice a problem? This is something that we've thought about. This is something that we want to do. It's a problem that we saw in the clinical setting. And now we want to figure out how we can make some changes and implement some evidence-based practice. So we're going to cultivate a spirit on inquire. So then step 1 is going to be to ask the burning question, right, about a clinical area of interest or an intervention. Okay, so you're going to formulate a question in what we call a PICO format. So PICO is P-I-C-O-T. We're going to talk more about that. P-I-C-O-T stands for population. It can be population, it can be patient, or it can be problem. So those 3 P's, either of those 3. Then the I stands for intervention. The C stands for comparison. The O stands for the outcome. and the T stands for time. So that is your little mnemonic that you use when you are creating a PICO question. The next step is that you gather the most relevant and best evidence. So you're looking through your scholarly articles, you're going on through nursing journals, medical journals, whatever it is that you need. They have to be scholarly articles, and you're looking for, you're learning about what other people have done, okay? And you're going to get the most relevant and best evidence. Then you're going to read it. You're going to critically appraise the evidence. Does it tell you what you want to know? Do you support it? You're going to gather it all together. Step 4 is to integrate the evidence with your clinical expertise, okay? So now we have the evidence that, let's just say, patient-centered rounds. Does patient-centered rounds improve patient outcomes and decrease falls? You know, whatever your question can be. So then you're gonna gather all your articles and all your information about patient rounding, and then you're going to combine it with any of your clinical expertise that you've seen in a clinical setting, or maybe you've interviewed other people with their clinical expertise. You're going to gather it with patient preferences, things you've learned from your patients, and then their values in making a decision to change. So you're going to apply that evidence. And then the last step is evaluating the practice, the decision or change. So did it work? Did what you implemented work? Was there, did it show that hourly rounding on your patients decreases risk of falls and improves patient satisfaction? So those are your 5 steps. So asking a clinical question in a P-code format. Some people use the T, some people don't. I was taught to use the T. I've included it in here. So step 1 is, once you decide on what you're interested in, take that thought and change and put it into a question. Formulate a clinical question. So a well-built clinical question should include these 5 things, which is the PICO. So P is the patient, the population, or the problem of interest. So if we use the analogy of hourly rounding to decrease the risk of falls, well, then your patient, your population there would be your patient, right? Your P would be your patient. Med-surg patients, you could say. And then your intervention would be hourly rounding. Your comparison would be, does it decrease the risk of falls? And then your outcome, and improve patient satisfaction. And then your time. So the time is when the comparison of interest is completed and the outcome can be evaluated. So, you know, maybe you want to trial it on a unit for, I don't know, maybe 6 or 7 months. And then after that 6 or 7 months, that's when you would complete your study, and then you can evaluate your outcome to see if it was beneficial or not. All right, so identify a PICO. So this is an example. Infections in hospitals can be spread on the hands of healthcare workers. It takes minutes to follow the hand hygiene policy before entering a room to deliver patient care. On a busy hospital unit where nurses care for many critically ill patients, those minutes add up. Many hospitals have turned to alcohol-based hand rubs to save time and put hand cleaners closer to patients. You're wondering if alcohol-based hand rubs are as effective as hand washing in preventing infection. So here in PICO format is just what we talked about. So your population is your hospitalized patients. Your intervention is your hand washing. Your comparison is hand sanitizer versus traditional hand washing. And then outcome would be, did it control infection? So that is how you would set up your PICO question. So step 2 is you're going to search for the best evidence to answer the PICO question, collect the most relevant and best practice. You're going to locate evidence to answer a clinical nursing questions or to support the development of a nursing policy, which requires an understanding of the information resources available to you. So where are you going to get your information from? So you, like we said earlier, you can get it from nursing journals, scholarly articles on you're going to learn more about different websites and databases that you can go to get this evidence-based information. You can get it from patient information. You can get it from your own practice, like we said a couple slides back. So, okay. The following pyramid that I'm going to show you guys next provides a basic methodology to I have such a terrible time with that word. The following pyramid that I'm going to show you guys provides a basic methodology. Nope, said it wrong again. Methodology to help you become familiar with some of the information resources that are available. The resources at the top of the pyramid are going to be considered your best evidence. However, you will not always find your topic addressed in one of these resources, and you will need to use a resource lower on the pyramid. So let's take a look at the pyramid. So you have your summaries of evidence at the very, very top. So we already said that these are the best, okay? These are your best resources right there. But sometimes when I was doing my bachelor's, I had to write a huge research paper. It was like, I don't know, 45 pages. And I was able to get a couple articles from summaries of, and like in that category, summaries of evidence, but I wasn't able to find a whole lot, maybe only like 2 or 3. So then you have to go down to other acceptable categories just lower on the pyramid. So then you have critically appraised research studies, then you have individual research studies, and then you just have your textbook, okay? So they're all acceptable, but obviously some are better than others, and you would gauge that by that pyramid. So the components of a research journal when you're doing a literature review. So we're going to talk about abstract, introduction, method, results, discussion, and then references. So your abstract is at the beginning of the article. It summarizes, and it is usually on the front page, it summarizes the entire article. It's a very small, maybe 2 or 3 paragraphs, summarizes the entire article, and usually provides the purpose of the study, a description of all the subjects that were included in the study, your data collection, your data analysis, and then it includes a summary of the important findings. So this is what we looked at. This was the problem, this is what we looked at, this is what we determined, and this is what we implemented, okay? So it's just a summary of the entire article and of the study. You have your introduction. So this is the literature review discusses relevant studies that have been conducted in this area of the study. A statement of the specific goals or purpose of the study often follows the review. You have method. The method section describes in detail how the study was conducted, including the type and number of subjects, the research design that was used, what data was collected, and how and the types that the analysis were done. There should be enough information so that the study could be replicated if need be. So can other people come behind you and take that information and replicate the study to see if they get the same results? So now we have results, or findings are often presented both in words. You can also put it in charts, tables, or graphs, and it is important to understand what the results were and whether or not they were meaningful. Your discussion, the discussion section reports what the results mean in regard to the purpose of the study and the literature review. It may also include suggestions for further research and application to your nursing education or your practice as deemed appropriately. You have your references. The references are always at the end of the article, and they include a list of articles and books that were used by you, the researcher. And then we talked about there being different online reputable databases. An example of one of those online databases, which are reputable, is Medline. And you guys, as you further your practice, even in this, you're going to learn, you know, what valuable references you can use, but you will know all the good databases, especially as you continue on to get your bachelor's and your master's. You'll learn a whole lot more. So we have summaries of evidence, which is your systematic reviews, your meta-analysis, your evidence-based clinical practice guidelines, and your evidence summaries. You have your critically appraised research studies, which are evidence summaries and reviews, critical research critiques, randomized controlled clinical trials, cohort and case control studies, which have been appraised by a peer review process and published in an evidence-based journal. You have individual research studies, which are your randomized controlled clinic trials, cohort and case control studies, case reports, and just case studies. And then you have your textbooks, which include, they're another level of evidence, but just a lower level of evidence. So they can be helpful when you're updating policies. And electronic textbooks tend to be more current and are evidence-based to varying degrees. So that's something to keep in mind about your textbooks. All right, so more of those reputable websites or areas on the web that we talked about. So you have the CCBC Library Database for Health Science, okay. CINAHL, CINAHL, is a reputable resource. Health Source, Medline. If you want to go and look at nursing journals, you can look through ProQuest, and then you have Science Direct, Elsevier. So step 3 in the process is, after identifying an article or a resource, you look at the information critically. So you read through every single article and critically analyze everything to determine if the information that you've gathered is reliable and valid. You conduct rapid critical appraisal of the studies that you find from your research. And things you want to keep in mind when you're critically appraising that evidence is you want to ask yourself 3 questions. The first one is, what were the results of the study? The second one is, are the results valid? So did the investigator measure, whoever was investigating, did they measure what was intended to be measured? Did they leave anything out? And were the results reliable? So were the measurements consistent across the entire time? And then number 3, will the results of the study improve patient care? Very, very important. So you might take all that time and research something, and maybe you use the topic of, does hourly rounding improve patient safety and decrease the risk of falls? So maybe you spend all this time all this time researching, and you go through all these articles and you do your own research, but then you find out that, well, hourly rounding does not increase patient satisfaction and decrease patient falls, which is not true. I'm just using that as an example. So step 3, again, if you were able to find information that answered your formulated question using any of the summaries of the evidence or critically appraised research sites, you can be assured that you have found valid information. So you know that if you're searching for the topic that we were talking about, and you were able to find any of that information under summaries of evidence or critically appraised, then you know you found really good, valid information that you can go off of. Okay, so step 4, whoops, one too far. Step 4. So this is the part where you're going to apply the evidence that you found. So you are going to integrate the evidence with clinical experience, including internal evidence that you were able to gather, your patient preference, and ways that you can best implement the best practice. So you're going to do staff education, right? And you're going to solicit the input of your staff members. You want to know what they think. Maybe there's someone who worked at another hospital that did patient-centered rounding and this worked better, or this didn't work. So you want to include them in that because you want them to be compliant with implementing whatever you are going to, whatever policy you're going to put into place. And it's important that you all work together as a team. So their input is very important. Then you're going to determine who should be involved in the approval process. So maybe you have a certain committee at the hospital that does these things. You're going to want to know who that is going to be. Patients want to be involved in decision-making about their care. If evidence is found to support a change, but the patient does not want it, the change should not occur. If the change that is proposed can be applied in a practical sense, or is too costly or too risky, then the change also should not occur. So those are just some things to think about. You want to conduct a trial implementation, okay? So maybe you're going to do it for 30 days or 60 days. It's not going to be a permanent, you're not going to do it throughout the hospital. Maybe you're going to try it on one unit for 30 or 60 days to see how it goes. For example, the most reliable method to determine if a nasogastric tube is placed correctly is by X-ray examination. However, this method of verification is very costly and it's more risky to the inpatient because you have to keep exposing them to radiation than other methods. So therefore, some facilities believe that it's not considered a preferred method in many situations. So other hospitals do things differently, like they do the the little acid test where they take some fluid out of the stomach and they put it into a little cup and you test the pH of it. And if it's a certain level of pH, then that means that the tube is in their stomach. Each hospital has their own policy. All right. And then step 5, we want to evaluate the evidence. So we want to evaluate the practice decision or the change. This step is very important because this is going to tell us if the change is effective for a particular patient or setting and if the expected outcomes resulted from the change. So we want to evaluate the outcomes of the practice, and if it's positive, we want to continue monitoring the best practice. We want to evaluate if the practice change should be accepted, rejected, or modified. We want to monitor the process and the outcomes. So if you're doing something on one unit, if you're implementing patient rounding, you're going to want to check in with the managers or whoever's heading this on the unit, and you want to find out how's it going, what's going on, are your employees receptive to it? Have you noticed any change? What have you seen? You want to assess the staff's knowledge and determine ongoing needs regarding the practice. So you want to constantly evaluate what are any barriers to the nurses being able to implement this care. Maybe short staffing is a problem and they can't get to the patient's room every hour because they have 7 patients. So those are important things that you need to know. You want to remember that implementing evidence-based practice is an ongoing process. So if things are constantly changing, you're constantly reevaluating things and you're constantly changing things. And then step 6 would be to disseminate the outcome of the evidence-based practice change. And it's very important for nurses and the patients that we care for to implement evidence-based practice in our clinical practice. When we do this, patients, healthcare professionals, and healthcare systems are able to place more confidence in the care that we deliver and know that the best outcomes for patients and their families are being achieved. So very, very important, evidence-based practice. And like I said, you guys are going to continue to hear a lot more about this. This is just the very beginning, but this just gives you a good overview of what you guys are going to expect. All right, that's it for evidence-based practice. And we are going to be moving on to nursing process next.